Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
Here at Mojo, we believe in facts first and only science-driven information. It's extremely important because many people say this is not just a pandemic, it's also an infodemic, and there is so much rumor mongering and so much panic and fear mongering that we've decided to actually break our coverage into extremely specialized segments where we'll be talking only to the experts. Joining us now on the program is Dr. Ambrish Mithal. He's one of our most respected endocrinologists. And we're here today to talk about diabetes and the coronavirus. What do you do if you're diabetic, if you're pre-diabetic, or if someone you care about, your friends, your family, has diabetes? What extra precautions should you be taking? Dr. Mithal, thank you so much. Let me start by asking you what people don't know. If you're diabetic, does it mean that you're more vulnerable to the infection per se? Or does it mean that if you get the infection, it has a much worse impact?
I think that's a great question, Barkha, because that's the starting point. In general, we reflexively feel that everyone who's a diabetic is more prone to infection. However, whatever limited data we have on the virus right now, it suggests that overall, diabetics are not at a greater risk of getting the infection. Now, the problem here is there is a qualification. We haven't really sort of sifted out clearly that which are the well-controlled young diabetics, which are the older diabetics with multiple other diseases. So maybe those ones are more prone, the older ones with multiple disorders. But as such, as of now, what the data tells us that diabetics are not really prone to a greater risk of getting the infection.
So basically, the second part, if you can elaborate on that.
The second part is very important, which is that do they have poorer outcomes? And I think there is no confusion about that. That people with diabetes, if they get a coronavirus infection, in particular, if it is associated with existing heart disease, hypertension, lung issues, or other even liver and kidney issues, but especially the first three, you really are at risk for much poorer outcomes. Now, this outcomes, what does the outcome story mean? It actually means that people who have uncontrolled diabetes and all these things together actually sometimes may have 3 to 4-fold greater risk of dying from the condition. So the outcomes are poorer in those who have diabetes, but as such, diabetics may not have a greater risk of just getting the infection.
But that's a very important statistic. I want to just recap simply in layperson's language what you've just said. You've said that if I'm diabetic, it doesn't mean that I have a greater risk of getting the coronavirus or the COVID-19 infection, but if I get it or once I get it, the impact on it will be much more sort of grave on me. Now let's combine diabetes with age. We already know the elderly are the most vulnerable group. I think that everybody agrees on, even while we don't agree on a lot else. If you combine those who are elderly with those who are diabetic, and as you know, my own father it fits that case, and I know many people's parents, a lot of people have written in with questions, have that category of people that they're worried about. So age combined with diabetes, Dr.
Yes, quite clearly, age and diabetes is not a great combination. And actually, they haven't really analyzed each of these separately, but it's pretty clear that the diabetics or the people with diabetes who had poorer outcomes were the older ones, and especially those who had pre-existing heart disease and hypertension. So quite clearly, it's not just that, as I said initially, it's we're trying to lump all people with diabetes into one, which is not probably true. And you know, a fit diabetic, a 40-year-old fit diabetic whose sugars are well controlled and otherwise is okay and no question of heart disease or anything, is probably at as much risk as a non-diabetic. But if you're talking of the elderly diabetic with coexisting heart disease, high blood pressure, and other conditions, then the risk of poor outcomes, bad outcomes dramatically increases. In fact, that's the main cusp of people, the main group of people that is actually succumbing to this infection. Now, there's a fact that we need to remember here. You need to remember this data about 20% being diabetic and all is coming from different parts of the world. You have to remember that at the age of 65, in our metros, 35 to 40% people have diabetes. Okay, so look at, and if you're thinking of the stress induced by a viral infection, etc., almost half the people that you'll be getting into corona wards in that age group will actually have diabetes. So for us, it's an even bigger problem because diabetes is so rampant here.
Yeah, I think those are important facts, and I think you're also talking about how as you grow older, in any case, your metabolism slows down. So how you're breaking down that sugar in your body, how you're absorbing it, is changing with age. And if you're not fitness conscious culture as we are still to catch up with, that is a problem. Now, Dr. Mithal, we did ask our viewers to write in with questions. We have a whole bunch of online questions, and I'm going to start taking them. We have a question from Sanjay Lazar. Sanjay Lazar says, Dr. Mittal, I saw a tweet somewhere that coronavirus affects diabetics and pre-diabetics much more and causes wild swings in blood sugar levels. Is it true? And if so, what are the precautions? Because I'm pre-diabetic and I worry for the millions of diabetics in India.
I think that's a very good question. There are some reports coming in, not scientific literature yet, where doctors are saying that they're seeing a lot of fluctuation in blood glucose in people who have coronavirus along with diabetes. Mm-hmm. So that's actually true for most infections. Also, the tweet he's referring to says that the doctor hasn't seen that with other infections to that extent. Mm-hmm. That's really just a personal observation. But any significant infection, any serious infection, can cause wild swings in blood glucose.
Not just this one, not just the coronavirus, but any infection.
Whether coronavirus is something specific there remains to be determined. But it is true that doctor colleagues are reporting from all over the world that diabetes does go haywire, as we often see in serious infections, and becomes harder to control if you have the infection. And therefore, obviously, you have to use techniques that we always discuss about insulin and adjustment of doses. During sickness, if you're really sick and if you have corona, insulin becomes a mainstay of treatment.
Okay. Our next question is coming in from Mudassar Shahid. Mudassar Shahid says, Dr. Mithal, anti-diabetic drugs were tested against the MERS CoV. Will ACE2 inhibitors possibly work against this virus?
So these are anti-blood pressure medication, anti-hypertensive medications, ACE inhibitors and ARBs, as we call them, which are commonly used, in fact, almost universally used in people with diabetes who have high blood pressure. So these are drugs where the last the suffix is pril, P-R-I-L, they end in P-R-I-L, like Ramipril, Captopril, whatever. Or they end in sartan, losartan, telmisartan, olmesartan, the sartan. These are used commonly as blood pressure agents in people with diabetes to protect the kidney and also to some extent protect the heart. Now, there is some data to suggest that this particular virus actually enters the cells through the ACE2 receptor. Now, these drugs actually increase the expression of ACE2 receptor.
What are ACE2 receptors? What are they?
Converting enzyme.
What does it mean? Just give it to us in non-medical lingo.
It means that there is an enzyme that converts angiotensin into a different form of angiotensin that trans cell surface. And when you have higher number of these ACE2s on the cell surface, it's thought to protect you. So these drugs actually increase the level of ACE2 on the surface of the cells. So they're protective. That's why they're used. However, this virus, for some reason, has a little spike that sort of hangs on or sort of interlocks with this ACE2 thing. And therefore, it enters, that's the entry point. It's like the doorknob, turning the doorknob into the cell. That is via the ACE2. Now, so this ACE2, which is otherwise beneficial for us, is actually used by the virus as a port of entry. So these drugs which enhance ACE2 and normally are beneficial, it is completely confusing right now. There is no data. Some suggestion, vague suggestion that these drugs may increase the risk of poor outcomes, but there is no proof at all, and others have contradicted it very strongly. So I think we have to wait for the data, but that's a fascinating, sorry to use the word, area of research in my field as to how these drugs will interact with the virus and with their body cells.
Well, of course, so much of what's happening right now is experimental, and we simply don't know. A lot of doctors are just trying experimental medication, and we have to wait for trials and actual research on this. There's another question from Meenakshi. She says, my husband has been a diabetes patient for 5 years. He's on medicine. He's only 37 years old, but he works in a bank, which means he's an essential service, and he's still working, even in this period of lockdown. What precautions should he take? I'm really worried.
I think that's a great question, and that's actually what's happening to many of my patients. I think he's 37 years old,
Yeah.
and I presume he's maintaining fitness. I presume his HbA1c, that 3-month average, and his blood glucose levels are under control. If he's a well-controlled 37-year-old diabetic, he doesn't have to worry too much. He has to observe the same precautions that are being drilled in and day out on television, on social media: hand washing, sneezing, coughing, the whole thing. The
No
respiratory
extra,
health,
nothing different that he has to do from what I'm doing, you're doing.
unless he's poorly controlled, in which case, if he's really badly controlled, he has to work hard on that and maybe even take a few days off to get his sugar numbers under control.
But if the sugar level is maintained, if the diabetes is in check, then the precautions are the same just as a non-diabetic person.
Well, for a 37-year-old, yes. For a
Okay.
37-year-old.
Okay. Kaiser has a question. Hello, doctor. My mother has been a diabetic since 20 years. And she's been taking human insulin N1. And then he goes on to talk about all the medication, which I think you'll be well aware of. But he says that sometimes the sugar level goes as low as 40. What should I be doing?
That's not
I mean,
a
40 just
corona.
sounds frightening. I mean, 40 sounds to me like she should be in hospital.
No. So this is not a coronavirus question. This is
Yeah.
anybody who's diabetic and on insulin or advanced diabetic with 20 years diabetes could potentially be getting low sugars. Now you really have to, there are many mechanisms and many reasons for that. But most of the time, I'll tell you, if she eats her meals on time, takes her insulin on time, doesn't sort of suddenly, reduce her intake drastically one day or inject less or more insulin, this should not be happening. Should really be in touch with your doctor to adjust your dose if low sugars are happening despite taking adequate precautions.
Well, almost all of our questions are asking many of the same things that you've already answered. Are people with diabetes more at risk? You've said no, but the impact of the virus will be much more grave. You combine that with old age, even more vulnerable. Sugar has to be maintained. It all depends on your fitness levels, your immunity levels. So let me now step back and ask you the larger picture. The larger picture is this. What risks other than social distancing should people not be taking? And I asked you in particular about masks. Now, every time I step out to report, and we are listed as an essential service, so I have the permission to go out and report. I've been going and meeting farmers and migrant workers. Every time viewers will write and say, Badka, why aren't you wearing a mask? Initially, I was not wearing one because my scientific understanding was that the mask should be left for healthcare workers if we don't really need them. Now I've started wearing one. What is your verdict on wearing a mask versus not wearing it?
So I think we'll have to take this question in two ways. The first is, let's leave out the availability aspect. Let's, for a moment, just not.
But we can't. How do we leave it out? PPE is in short supply.
Yeah, I'll come to that. So supposing this wasn't an issue, if this wasn't an issue, as it was not in many East Asian countries, then I think wearing a mask, you can't go wrong if you wear it properly. If you don't touch the outside, take it off, put it on properly, I think it's all right. What I would say is every time you
when I take off the mask, I'm always touching the outside. You're saying the mask has to be taken off from those strings.
Yeah, you have to follow all those drills that are given.
Okay.
If you follow those drills, then every time you're in a crowded place, which could mean any public place, for you it's important. For us, obviously, we're healthcare providers. So, or if you're going to your doctor's outpatients department, where there are 20 people waiting, then I think perhaps you should wear a mask, other than those where there's no controversy. Anybody who has a cough has to wear a mask. Obviously, anybody who is corona proven is already in isolation and has to wear a mask. So the main purpose of the mask is to prevent the droplets from coming out of the mouth and spreading from someone who's already infected. The problem is that in crowded places where you don't know anybody, you're not sure who's infected. And you're also not sure, many of them may carry the infection even without any symptoms. And you don't really need a massive coughing bout to propel those viruses.
So it could be asymptomatic, entirely asymptomatic, and you could be picking it.
Actually, also it's infectious. So not as infectious when you are symptomatic, but still it is infectious. So therefore, I think that if there is no real shortage issue, I would say when you go to a crowded place, I would wear a mask if I went to a crowded place. If I had to travel in a metro today, or if I was traveling by bus, for whatever reason, then I would wear a mask. I wouldn't wear a mask if I just it's a one-to-one interaction with somebody like that. But wherever there are lots of people, even though I'm not coughing, even though I'm not personally vulnerable, I would probably wear a mask.
Now, I want to ask
doctors, you look at the Chinese doctor, I can forward that data to you. He says that the big mistake that the Western societies are making is by avoiding masks. And he
It's very
says that
interesting because I was interviewing the World Health Organization's chief scientist, and she said, "I'm sitting in Switzerland and I'm not wearing a mask." But I mean, I think this is such a hotly debated thing that people are really confused. But what I'm hearing you say is there's no downside. So if you have
if you wear
access,
if you have access, and
enough.
access not issue, you wear it in every crowded environment. Otherwise, it's if there's a shortage, there's no question. The priority goes to those who are sick and to healthcare workers.
Let's talk about your community, being a doctor, being at the front line of this battle. What is the most sort of the biggest vulnerability that your profession is feeling right now? Every young doctor I'm speaking to is basically talking about the PPE, the personal protective equipment. I think that is something that's concerning people, especially in smaller towns. I went to All India Medical Institute. They said, "Yahan to hai, but what about for ancillary staff? What about for security guards? What about for mess boys? What about for ward staff? What about for nurses?" And in smaller medical colleges, the situation is even more dire.
Yes, I think we have to prepare for that. I understand that a lot of PPEs, as we've started using the term, personal protective equipment, has been ordered. And it's on the way, and a lot of it is in place also, I'm told. But it is incredibly important to protect healthcare providers. And this is not doctors alone. Nurses are in closer contact with patients. The housekeeping staff who move them are in very close contact. So all of them are equal. In fact, nurses are probably the most susceptible. I think it's important, especially if you're working in respiratory lab or endoscopies, bronchoscopies. That's really dangerous. So I think personal protective equipment is one very important part. And also, while doctors do observe measures, this is extra stringent measures. You really cannot make a mistake here. And there are two reasons for that. One is that as healthcare professionals, if you're affected, then one line, the people who are supposed to fix this thing are gone. So I really think that larger hospitals, at least, which are corona-friendly hospitals, are making arrangements for that, should have layers of doctors. First layer, second layer, third layer. Don't expose all your doctors at the same time because some will get affected. So, divide one, maybe 3 layers or 4 layers.
I
This is
mean,
the first line.
the problem with that is we don't have enough doctors per population to stagger it.
At least where you can in larger hospitals, which are being designated as corona hospitals by the government, and hospitals which have volunteered to do this. This is the way it has to go, ideally, right? The second part that we forget, and doctors sometimes can be brave, not realizing initially, but I think now everyone's very aware, is that if you are infected, it's not just you. You may be big and strong, you may get by, but you may infect hundreds of your patients. And there are examples of that. There are super spreaders. So medical healthcare providers, healthcare personnel, medical personnel are actually seriously involved in this for two ways. Number one, if they're affected, our line of defense against the virus is gone. Secondly, they are super spreaders.
And I want to ask you, in fact, that's such an important point because, we've done a report from Bhilwara in Rajasthan. And in one hospital there, the Bangar Memorial Hospital, it's a private hospital, one doctor tested positive, and now at last count, 13 doctors and medical staff are in isolation wards. And in China and Italy also, we saw that hospitals become vectors. Hospitals become vectors. So then what happens? And this doctor, I believe, treated 6,000 patients before it was discovered that he was positive.
I mean, sorry to use the word, but there are some hospitals mentioned in the Chinese literature as virus factories. So this, we can learn from the experience, right? We cannot be overcautious. Now, I understand the limitations. We will not have adequate PPE. The PPE that Americans are using is different from the PPE that Chinese are using. Chinese are using astronaut type of stuff. Americans are using not very fancy PPE. So, you have to take a call, and the government has taken a call what constitutes PPE. And we have to go ahead with that. And then, of course, we know that there are going to be gaps. We know that there are going to be challenges, but we have to take it as it comes. The only thing is that we have to make sure there is no negligence on our part. And as doctors, we have to make sure the system we work in, as far as possible, protects us and allows us to serve our patients and heal them well.
One last question. The Indian Council for Medical Research has recommended the use of hydroxychloroquine as a kind of preventive for healthcare workers. Now, this is purely experimental. The WHO is not recommending it. The jury is totally out. Lab sort of surveys from China and France with very small samples say the results have been positive, but they've never actually necessarily been applied to patients. And what's very interesting is I was talking to a doctor in a district hospital, a government hospital in Shamli, small district in Western UP. And he said, listen, I'm treating my patient just how I treat a flu patient because we have no medication. So I'm keeping him hydrated and I'm just trying to do what I do with the flu patient because I don't know what else to do. Would you sort of recommend hydroxychloroquine in the way that the ICMR has?
So, okay, this is the challenge because the epidemic is ongoing and we don't have data. So whatever data we have on hydroxychloroquine is based on treatment data, which is also more anecdotal. It's not seriously peer-reviewed, double-blind, randomized, not the way it should be ideally. That showed some benefit. Having said that, there are 2 points here. Hydroxychloroquine has been shown to work against some viruses in the past, even some viruses of the same family. And secondly, we are used to the drug for decades together. It's used in rheumatoid arthritis. It's used in so many other inflammatory conditions, SLE. It's also been its counterpart, chloroquine, has been used in malaria for 70, 80 years, I think, maybe more. So I think because of lack of evidence, we cannot clearly say, yes, this is going to help. But on the other hand, as someone who has used these drugs for a long time, I tend to agree with the ICMR. I don't want to figure out 6 months later that if I had taken this relatively innocuous drug, I would have saved my patients, saved my healthcare workers.
Yeah.
Very important point is that this is a drug approved in India for treating blood glucose, for lowering blood glucose. It's one of the anti-diabetic drugs, and it is being used for that purpose. It's an approved drug for that. So if you're a diabetic and at high risk, and you fall in that category, elderly, that, and there is no major cardiac problem of them and all, then you may be a candidate. So I can't say this way or that way because we can't push the science, but you can be a candidate. And I think ICMR, in its wisdom, I tend to agree with them at the moment.
All right, Dr. Mithal, I think what's happening is the science is changing literally every day and we're finding new information as we go along. The one thing I'd urge all of you is to urge the government to test more. Everyone seems to think we're under testing. Any last thoughts on that?
So I definitely think we should be testing more now. I believe it's been unlocked, the whole mechanism, but it's not really burst through yet. So I expect in a day or two, it's going to change dramatically. And I think the kits are in place in most places, or they're getting there. So I think testing is very important right now. One important point before we part is that testing is also important for my diabetes patients. At this point, they must test their blood glucose regularly. They must make sure that they have their supplies in order. No panic, but at least have 3-4 weeks of your insulin, of your blood glucose. Don't hoard, but make sure you don't suddenly run into a crisis. So very, very important not to stop testing. And while you're in home confinement, you maintain a social distance from your refrigerator also. So I think it's important to be at least 6 feet away. Otherwise, all day we'll be snacking and we'll all put on weight during this 3-week period. Some of us who are in this environment, they are dying of starvation. That's a different story.
Absolutely. There are poor people out on the streets with no food and we're binge eating from our fridges. That is the inequity of our society. But may we all be able to convince our parents of what you've just said. So many of our parents, so many of our viewers' parents are in that category that you talk about. Pleasure talking to you. We'll keep talking to you through these weeks because the science is changing every day. Thank you, Ambrish Mithal. Thank you.
Thank you, Prakash.